antiseptics, disinfectants, and ectoparasiticides. So, antiseptics and disinfectants are those substances which inhibits or kills microbes on contact. Okay, so those agents which are used on living surfaces are called antiseptics, and those agents which are used on inanimate objects like instruments, privies, or water supply, so those are called as disinfectants. And germicide is a term which is used both for antiseptics and disinfectants. So sterilization is complete killing of all forms of microorganisms, whereas disinfection is reduction in the number of viable pathogenic microbes. Let's know some of the pioneers who contributed to this antiseptics and disinfectants. Okay, so Sir Ignace Philippe Semmelweis, he was an early pioneer of antiseptic procedures, and he was described as the savior of mothers because early days the maternal death was more because of infection which happened during the process of labor and immediate postpartum. So he proposed the practice of washing hands with chlorinated lime solutions before and during conducting of delivery, and this drastically reduced the incidence of maternal mortality, and hence he was described as the savior of mothers. And another famous scientist, Joseph Lister, he was a British surgeon and a pioneer of antiseptic surgery. So, and he promoted the idea of sterile surgery, and he used carbolic acid, which is otherwise called as phenol, as an antiseptic. So, phenol was the first antiseptic used for surgical sterilization. Okay, and he was called as the father of modern surgery. And the instrument you are seeing here is the carbolic steam spray apparatus which was used by Joseph Lister for sterilizing his surgery. So the mechanism of action of germicides. All the germicides act through either one of these mechanisms: oxidation of bacterial protoplasm, denaturation of bacterial proteins, and detergent-like actions. The potency of a germicide is measured in terms of phenol coefficient or Riedel-Walker coefficient. So this is the ratio of minimum concentration of test drug which is required to kill a 24-hour culture of typhoid bacilli in 7.5 minutes at 37.5 degrees centigrade to that of phenol under similar conditions. So we are measuring the potency of a test drug. We are comparing the potency of the test drug with that of phenol under standard conditions, and this is called as phenol coefficient, which is used as a measure to describe the potency of germicide. So these are the classification. So these are all the various germicides we have. We have phenol derivatives, oxidizing agents, halogens, biguanide, quaternary ammonium substances, soaps, alcohols, aldehydes, acids, metallic salts, dyes, and furan derivatives. We will see one by one. So phenol derivatives, we have phenol. So phenol, it was the first antiseptic used, and it is a general protoplasmic poison, and it is very caustic. Okay, so it caustic to the skin surfaces, and it is mainly used for disinfection of urine, pus, feces, and sputum. And phenol is also used in some antipruritic preparations because it has some local anesthetic action as well. The next phenol derivative is cresol. So cresol is nothing but methyl phenol, and when compared to phenol, it is less damaging to tissues, and it is used for disinfection of utensils and for washing hands. So the Lysol which we use commonly for household cleaning purposes, it contains cresol. The next phenol derivative, hexyl resorcinol, and it is odorless. It is an odorless non-staining phenol derivative. It is mainly used as an ingredient in mouthwash, lozenges, and antifungal preparations. So the strepsils, which is a famous lozenges which we use for sore throat, it contains hexyl resorcinol. Another phenol derivative, chloroxylenol. So it has a phenol coefficient of 70. It's a highly potent germicide. It is mainly used for surgical antisepsis. So the famous Dettol, it contains 4.8% of chloroxylenol. So this is an important MCQ for your PG entrance exam. So Dettol contains 4.8% of chloroxylenol, and this chloroxylenol is also used in lubricating obstetric cream. When we do vaginal examinations, we use lubricating obstetric cream, and which contains 1.4% of chloroxylenol. And in soap and skin creams, we use 0.8% concentration of chloroxylenol. Okay. The next one is hexachlorophene. It is a chlorinated phenol. Okay, so the concentration of more than 2% of hexachlorophene is banned because it causes brain damage to children. Okay, there were more incidents of encephalopathy in children when hexachlorophene was used previously in bathing solutions. So when children were given bath, okay, so hexachlorophene was used in these bathing water in order to prevent the incidence of staphylococcal skin infections. But later they found out that when hexachlorophene was used more than 2%, it caused severe brain damage to children, and hence it was banned. Okay, more than 2% use was banned. Next group of antiseptics or oxidizing agents. So oxidizing agents mainly act by liberating oxygen. So when the material contains more of organic matter, then you can use oxidizing agents. So the first one is potassium permanganate. It is used for gargling, douching and irrigating cavities purposes. Okay. So you have a solution called as Conti solution, where potassium permanganate is used in the ratio of 1 is to 4000 to 1 is to 10,000 solution. So this Conti solution is used for all the above said purposes. So it causes rusting, so it is not suitable for disinfecting surgical instruments. The next one is hydrogen peroxide. So you must have all seen hydrogen peroxide while dressing the chronic ulcers. Okay, so the diabetic ulcers and chronic venous ulcers, when you dress these ulcers, we use hydrogen peroxide as an disinfectant. So it liberates so much amount of oxygen, and it is used in removing slough and earwax. Next one is benzoyl peroxide. So this has a specific action against acne, the propionobacterium acne, a bacillus which cause bacteria which causes acne. So it is used in anti-acne preparations. So that's all about oxidizing agents. Now we will move on to halogens. Iodine, it is a halogen used as a disinfectant. So you have various iodine preparations. Tincture iodine has 2% iodine in alcohol, which is used on cuts and for degerming skin before surgery, and also to treat ringworm. Okay, and Mandel's paint, it contains 1.25% of iodine. It is used for sore throat. Iodine ointment, the famous Iodex, so it contains 4% of iodine. It is used as an antiseptic and counter irritant. Iodophores are soluble complexes of iodine with a large molecular organic compound, so that it releases iodine very slowly. So you have povidone iodine, otherwise called as polyvinyl pyrrolidone. So it is a famous iodophore which is used on boils, furunclosis, burns, otitis externa, ulcers, tinea infections, monoidal trichomonal, non-specific vaginitis, and for surgical scrubbing, and it is also used for disinfection of endoscopes and instruments. The next halogen is chlorine. So you all know chlorine at a concentration of 0.1 to 0.25 ppm, it kills most of the pathogens except tuberculosis bacilli in 30 seconds. So you have to achieve a free chlorine concentration of 0.2 to 0.4 ppm in order for effective to get an effective disinfection. So chlorine demand is the difference between the amount of chlorine added and the amount of residual chlorine remaining after a given contact time. So when the chlorine demand is more, so that means you have to add more chlorine in order to achieve the free chlorine concentration. And chlorophores, it is similar to iodophores. So they slowly release hypochlorous acid. Okay, so the famous chlorophore we all know is chlorinated lime, otherwise called as bleaching powder. So it is used as disinfectant for drinking water, swimming pools, and as sanitizer for privies, etc. So another chlorophore is sodium hypochlorite solution, which is used in dairies for milk cans, okay, and equipments and infant feeding bottles disinfection. Okay, so that's all about halogens. Next, we will see about biguanide. Chlorhexidine is a biguanide used as disinfectant. So you should not confuse biguanide with, which is used as an anti-diabetic drug. Okay, metformin is a biguanide used as an anti-diabetic drug, and you have chlorhexidine. It is also a biguanide used as disinfectant. So you should not confuse both. And chlorhexidine is most widely employed antiseptic in dentistry. So it has a major role in dentistry. So 0.12 to 0.2 percentage of oral rinse or 0.5 to 1 percentage toothpaste is commonly used. So it's mainly used in the prevention and treatment of gingivitis. It reduces oral infections in immunocompromised patients. So immunocompromised patients are more prone to get these oral infections, opportunistic infections. So this chlorhexidine is used in the prevention of those infections. The next group of disinfectant is quaternary ammonium antiseptics. So cetrimide, it is a antiseptic which is used alone or in combination with chlorhexidine. So one of the most popular hospital antiseptic, and it is also a disinfectant. It is used both as an antiseptic and disinfectant for surgical instruments, utensils, baths, etc. So the famous antiseptic Savlon, it contains chlorhexidine 1.5 percentage and cetrimide 3 percentage. So this is again an important MCQ for a PG entrance. So Savlon contains chlorhexidine 1.5% and cetrimide 3%. The next group of antiseptics or alcohols. So you have uh, ethanol, that is ethyl alcohol, and isopropyl alcohol. So these two alcohols are used as an antiseptic. And isopropyl alcohol, so they are used in the concentration of 40 to 90 percentage for effective antisepsis. So the most of the sanitizer which we are using now, it contains isopropyl alcohol or ethyl alcohol in the concentration between 40 to 90 percentage. So more than 90 percentage is also useless. It loses the antiseptic property. Okay. The next group of antiseptics are aldehydes. So you have formaldehyde. So formaldehyde is a pungent gas. It is used for fumigation purposes. So in operation theaters before starting the surgery, the theaters are fumigated with formaldehyde. Okay, so it is a disinfectant. And formalin, you all know, it is used for hardening and preserving dead tissue. So you must have seen in the anatomy dissection classes, you must have seen the dead bodies, cadavers are embalmed using formalin. And methenamine, it is an urinary antiseptic. Okay, so it acts by releasing formaldehyde in acidic urine. So this formalin is also used to precipitate toxoids from toxins. So we get toxoids, we use the various toxoids for vaccination purposes. So this toxoids is obtained from toxins by this formalin. And another aldehyde, glutaraldehyde, in a concentration of 2 percentage, is used to disinfect the surgical instruments and endoscopes. This is again an important MCQ for PG entrance. Okay, 2% glutaraldehyde is used to disinfect surgical instruments and endoscopes. The next group of antiseptics are acids. So you have boric acid. Boric acid at a concentration of 4% aqueous solution is used for irrigating eyes, mouthwash, douche, etc. And boroglycerine paint at a concentration of 30% boric acid is used in stomatitis and glossitis. And boroside, which is a 10% boric acid ointment, is used for cuts and abrasions. And boric acid is also included in the prickly heat powders and eardrops. Okay, the next acid is acetic acid. So acetic acid, the most important feature is Pseudomonas is susceptible to acetic acid. So it is used in burn dressing in 1 to 3 percentage strength. The next group of antiseptics are metallic salts. So you have silver nitrate, silver sulfadiazine, okay, silver salts. So silver nitrate is used in tonsillitis and aphthous ulcer, and 1% solution of silver nitrate is used for the treatment of ophthalmia neonatorum. And silver sulfadiazine, it is highly active against Pseudomonas and it is used on burns. Zinc sulfate is used as eye and ear drops and also for acne and impetigo. And calamine and zinc oxide, so they are used as dermal protectives and adsorbents. The next group of antiseptics are dye. Gentian violet is a purple colored dye. It is used in furunculosis, bed sores, chronic ulcers, infected eczema, thrush, Vincent's angina, ringworm, etc. So it causes deep staining. The next dye is acriflavine and profilin. It is an orange-yellow acridine dyes. So bandages are impregnated with this acriflavine vaseline and it is used for burn dressings. And you have triple dye lotion which contains gentian violet, brilliant green and acriflavine. Three different types of dyes are mixed in specific proportions and it is used as a lotion. And it is used for burns and umbilical stump dressing in neonates. The next group are furan derivatives. You have nitrofurazone. It is used in burns and skin grafting. And you have two antiseptic. You have an urinary antiseptic called as nitrofurantoin and an intestinal antibiotic called as furazolidone. So these two drugs, they are actually furan derivatives, but they are used for urinary and intestinal infections. Okay, so that's all about antiseptics and disinfectants. Now we will see about ectoparasiticides. So these are the drugs which are used to kill the parasites that live on the body surface. So the lice and mites. So these are the two important parasites which live on the body surface. So the drugs acting against these ectoparasites are permethrin, lindane, benzyl benzoate, crotamidone, sulfur, dicophane, ivermectin. So permethrin, it acts by causing neurological paralysis in insects and it is the first choice of drug for scabies and pediculosis. Lindane is otherwise called as gamma benzene hexachloride. It is a very highly lipid soluble drug. So because of this lipid solubility, it causes systemic toxicity. Okay, so it is not the first choice of drug for scabies and pediculosis. And benzyl benzoate, this is the second choice of drug for scabies after permethrin. Okay, so the emulsion of benzyl benzoate is applied all over the body except face and neck after a cleansing bath, and the second coat is applied the next day, which is washed after 24 hours. So this is the way by which these preparations are applied to treat scabies infection. Okay, for scabies you have to apply the drug all over the body. Okay, 2 coatings you have to apply and then you have to wash after 24 hours. Ivermectin, you must have all known, it is an antihelminthic drug. It is also effective in scabies and pediculosis. And it is an orally administered drug. So it is not used as a first choice drug because of systemic toxicity. So it is used when the other drugs, other topical agents are ineffective. Then you can go for ivermectin. Okay, so scabies is a highly contagious disease. It is caused by mites. Okay, so the mites burrows through the epidermis. It lays eggs there, which form papules. So it causes intense itching. So mainly the palms, the finger webs and the palms are affected most commonly. Later it spreads to all body parts. So scabies management. So you must remember all the members of patient's family should be treated. Okay, since it is highly contagious and infectious, all family members should be treated simultaneously. When there is secondary infection, then you have to use appropriate systemic antimicrobial therapy, and all the garments and bed lining, everything should be washed in hot water and put in sun in order to prevent cross infection and reinfection. And the drugs used, we already seen permethrin, it is the first choice of drug. Then you have benzyl benzoate, lindane, sulfur, ivermectin or other drugs which are used. And pediculosis is a lice infestation. Okay, the lice, when it thrives on the head, we call it as pediculosis capitis. When it is on body, we call it as corporus, and when it affects the pubic region, it is pediculosis pubis. Okay, so it causes severe itching. So the main problems with pediculosis infection, it sucks the blood and transmit typhus and relapsing fever infection. So it has to be treated. So the drugs used for pediculosis are again permethrin, first choice of drug. Then you have lindane, crotamethone, ivermectin. So these are the other drugs which are used. Okay, thank you.